Think you know all the subtle symptoms to spot a serious illness? Think again. Let me share with you a story. I had a very pleasant 61-year-old gentleman, active and healthy, enjoying a bike ride on a sunny afternoon. Life seemed good. But later that day, he notices something unusual. His urine is brown and rusty looking. He feels fine otherwise, no pain, no discomfort. He chalks it up to dehydration from the bike ride and drinks more water. However, the unusual urine color persists. Concerned, he decides to see his doctor. The doctor orders a simple urine test. The results are negative for a UTI, but it does show blood in the urine. Not surprising. Interestingly, there's also protein in his urine, and his creatinine level is slightly elevated at 1.5, telling me his kidneys are slightly stressed. This is new for him. Although he feels well, the presence of blood and protein in his urine raise concern. I explained these findings don't always mean a serious problem, but further investigation is needed with his primary care provider to rule out any underlying conditions. 4 days later, he develops cold symptoms. He is seen at a same-day clinic, and COVID-19 is ruled out. He is advised to treat this as a normal cold, and he goes home following those instructions. Unfortunately, he starts feeling worse. He is vomiting each morning when he wakes up. He also sees more blood in the urine with each morning void. Finally, he gets in with his primary care provider. Based on everything that has been going on with this patient, the primary care provider decides to further his workup. A CT urogram is ordered, but will not be performed for another week due to availability. A referral to urology is also placed, as there is another increase in his creatinine again. He has climbed up to 1.7. His kidneys are showing clear signs of distress. Unfortunately, this patient can't seem to catch a break. His cough is still bothering him. He also is experiencing chills, fatigue, back pain. To obtain a clearer picture of what's happening, the doctor orders a chest X-ray. The results are not completely clear, but the X-ray identifies some patches on both lungs that are thought to be either chronic or acute. To be safe, he is placed on doxycycline. A few days later, he finally gets in for his CT urogram. Here are the results. Large infiltrative mass at right mid to lower kidney, about 8 by 7 centimeters. The CT urogram also picked up some nodules in his lungs. Biopsy confirmed the cause of his symptoms are oncological, deeming this right kidney cancer with metastasis to bilateral lungs. This explains the range of seemingly unrelated symptoms he has been experiencing. This case highlights the importance of recognizing even subtle changes in patients and highlights an urgency to gain a clear diagnosis. What began as a seemingly insignificant observation of brown urine after a bike ride turned out to be a sign of something far more serious. While blood in the urine doesn't always indicate worst-case scenario, ignoring it can have serious consequences. Early detection is crucial for improving the outcome of many diseases, including cancer. Remember, make an effort to put the puzzle together when it doesn't add up. Blood in a patient's urine is never normal, even if the patient feels okay. A cough that doesn't follow the typical pattern and has vague imaging results warrants further questioning. Always consider that an underlying cause might be clouding the clinical picture. The right care starts with the right workup, because every decision depends on what you see first.